Good seeing you.
Yeah, good to be back.
What's bringing you back in?
My sciatica, my back. It's kind of been an ongoing thing.
Sciatica and your low back.
And my low back.
Yeah, now it's been about 6 months that you've been in.
Mm-hmm.
So the last treatment was amazing. I guess it lasted 6 months. Just kidding.
Yeah,
Just kidding. You probably went had some waves up and down. So was this most recent one a flare?
Yeah, it's definitely been, since I came in last, it's definitely been something that's kind of just lived at the lower levels of pain and discomfort. It hasn't been too bad. I just manage it with, just stretching and things like that.
What's your low grade number out of 10?
I would say the lower end is probably a 3. It lives between a 3 and a 5 to 6, I'd say, average.
And that's pretty constant?
Yeah, pretty constant. Yeah.
Both low back and sciatica, or more the low back?
Definitely more low back. Occasional sciatica, like down the legs, and I get the pain in my feet from time to time. But it's pretty steadily in the back is where I'm feeling it most of the time.
And then when the back elevates, is that when the sciatica starts to flare?
Yep.
Okay. So sciatica is intermittent.
Correct.
And it's still the right sciatica?
It was, and then this last time I'm feeling it. It's across the whole low back, but on this particular instance, I'm feeling it more on the left side.
Okay.
And
so it's left especially, but in the past we've treated you and it's been the right side.
Down the right leg, yeah, and this time on the low back on the left side. So it's kind of weird, I guess. So what happened was last week, and it's kind of similar to the initial injury. I think it was just we were moving some heavy things around, putting them in and out of a trailer, just kind of moving, and it wasn't. I didn't feel the pain right away. Just honestly, the next morning is when I really felt it starting to kick in. Just picking up heavy things, moving around. I felt fine doing it. I kind of am conscious of, but obviously not as much as I could have been. But then the next morning, I just felt it.
And then what's the numbers now since the flare up?
I'd say it's probably 8, 9 occasionally. I'll get a spike depending on how long I'm sitting.
8, 9.
Yeah.
And right now is it 5?
It's probably about a 6, 7.
Okay.
Yeah, I went for a walk. Walking helps. I went for a walk this morning.
Okay.
But,
and then typically after your last acupuncture treatments, I saw you in December, I saw you in November twice last year, October of last year as well.
Mm-hmm.
How much relief do you normally get?
It's been great. There's definitely an immediate, like when I walk out of here, it definitely feels a lot better. It does last. It will come back, obviously, but I think the treatments are definitely helping. The pain is much less, and it does.
Are you getting about a week of relief afterwards, or?
I'd say probably, honestly, I guess to the point where I kind of forget about it a little bit.
Okay.
And then I don't really notice it until a week later. Or some.
And in the prior flare-ups, we've kind of done 2 or 3 treatments closer together.
Yes.
A week apart, maybe 2 weeks apart,
Yep.
and then you seem to be okay.
Yep.
For 3, 4, or 5 months until something spikes it.
Yeah, until
Okay.
I do it to myself.
Awesome. Well, we'll get you up on the table.
Okay.
Perfect. Thank you.